Welcome, listeners, to Snippit Sports Science Podcast by me, Jared Coleman-Stark, and Chris Gaviglio. How are you doing, Chris?
I'm good, thank you. And also by eliteform.com.
Yes, big thank you to eliteform.com. Please visit our sponsors at their website. We would appreciate that very much. And let them know that we sent you, because we don't have an affiliate link or anything like that. So maybe just send them an email and tell them that you heard about eliteform.com at Snippet Science. That would be pretty cool.
And what are we talking about today, Jared? This is our last one on the heat, isn't it?
That's right. And today we're going to be trying to answer the question, do thermal agents affect range of motion and mechanical properties in soft tissues? This is going to be a systematic review on this topic, so it's a little bit of a bigger paper, but we're going to try and distill it down for the audience and try and get through it in our usual short and sharp snippet manner.
And typically you select really good systematic reviews as well. Now, the basics behind this whole type of paper and the information behind us when we look at it is around the application of thermal agents such as heat or cold is popular in clinical and rehab type settings. Altering tissue temperature can have a range of therapeutic effects through changes in metabolism, nerve transmission, hemodynamics, and mechanical properties. And obviously, as we know, as temperature of muscle goes up, so can performance, but also when the core temperature comes up, the fatiguing effects can also have effect on performance. Increasing soft tissue temperature prior to exercise is an accepted practice, and this can involve active warm-up or local heat application using warm water immersion or hot packs. We've actually spoken a lot around passive heat maintenance as another great way of maintaining that heat once you've warmed up, and also could be that almost like a way to pre-warm up prior to your warm-up. Heat's thought to alter the viscoelastic properties of muscles and the other collagenous tissues in preparation for physical activity or rehabilitation. On the flip side, cryotherapy is the application of cold for therapeutic purposes. Pre-cooling based on cold water immersion can be done also through ice packs or ice vests, and this has gained widespread acceptance as a method of offsetting thermal strain and fatiguing and increasing aerobic and anaerobic capacity during competitive exercise. Other authors advocate the application of cold prior to therapeutic rehab exercises, such as through cryokinetics, to induce analgesia and increase volitional muscle activation around injured joints. The biomechanical properties of collagenous tissue represent an important component of function. In vitro studies, they clearly show that the mechanical properties of ligaments, tendon, and muscle are significantly influenced by temperature, and this may suggest that heat and cold should not be used interchangeably in a rehab setting. From this, the aim of the paper was to undertake a systematic review to examine the effect of thermal agents on the range of movement and the mechanical properties of soft tissue in vivo and discuss their clinical relevance.
I think the most important thing about the methodology in a systematic review is how they select the studies to include. And so here briefly, they've selected studies that involved human participants describing the effects of thermal interventions on range of motion and or mechanical properties in soft tissue. In a little bit more detail, the studies must not only involve human participants, but also undertake some sort of thermal intervention, whether it's hot or cold to the soft tissue. The interventions could not be used with or without concomitant stretching exercises. No restrictions were made on the mode, duration, or frequency of interventions, and the studies must have reported on at least one outcome relating to range of motion or mechanical properties of soft tissue. For example, stiffness or other viscoelastic properties. These could be based on either active or passive movements. There were no restrictions made on study design or comparison group. So from the inclusion criteria, Chris, do you want to tell us a little bit about the studies that they actually did include?
There were 36 eligible studies comprising a total of 1,301 healthy participants. The average sample size was just around 35, with the largest study based on 120 participants. And these people tended to be young, and the mean ages were reported to be between 20 and 30 years of age. In the majority of cases, the thermal intervention was applied in isolation to the muscle tissue. The remainder immersed the entire body parts in water or a target joint region. When we look at the details of the thermal interventions, we're going to talk about heating and then cold. So firstly, the heating interventions were classified as superficial agents, such as infrared, hot packs, hot water immersion, or electric heating pads. and deep heating agents, such as they used ultrasound or short wave diathermy. The duration of the treatments ranged between 30 seconds and 60 minutes. It's quite a large difference. All but 6 of the studies applied heating for at least 10 minutes. One study heated until a predetermined muscle temperature increase occurred. No other study recorded tissue temperature changes associated with heat application. On the flip side, cooling was undertaken topically, with the majority using ice cubes, cooling pads, and cold water immersion for durations between 10 and 60 minutes. A further 2 studies employed brief application of a vapocoolant spray. Skin temperature reductions were reported in 4 cases. 3 studies lowered the temperature between 18 and 23 degrees, with 1 study cooling to 10 degrees Celsius. Intramuscular temperatures were reported in 1 study, with reductions to 28.1 degrees.
Going into the details of the outcomes, 28 out of those 36 studies recorded range of motion. 16 studies measured active range of motion based on goniometric or inclinometer measurements. 3 of these used active weight-bearing ankle dorsiflexion, and a single study recorded trunk flexion using a sit-and-reach test. 11 of the studies measured passive range of motion, and in 1 study, it was unclear whether range of motion tested was active or passive. 6 of the studies measured accessory joint movement in response to anterior, posterior, valgus, or varus passive forces at the knee joint using an arthrometer or related device. 4 of the studies measured passive tissue stiffness based on the relationship between joint torque and range of motion. 2 studies recorded passive tissue force or torque using an isokinetic dynamometer or similar device during slow, such as 3 to 5 degrees per second, passive movements of either the knee or the ankle in the sagittal plane. In both cases, real-time ultrasonography was used to determine muscle fascicle length throughout the movements.
Straight on to the results or the findings here. When we look at the effect of cold, if we look at hip flexion range of movement, 3 studies examined the immediate effect of topical cooling on hip range of movement, and 1 study found that 20 minutes of cooling over the hamstring muscle had little effect on active knee extension in supine position, laying on your back. In contrast, large increases in hip flexion, straight leg raise, were recorded immediately after a 20-minute ice pack application and brief sprays of vapocoolant. That really surprised me, actually, honest, that you actually had an increased range of movement. Anyway, with respect to ankle range of movement, before and after a 20-minute cold water immersion of the lower limb, with follow-up recordings every 5 minutes for 30 minutes, the only significant findings were a decrease in ankle dorsiflexion at 7 to 12 minutes. Otherwise, besides that, there was insufficient data for effect size calculation. Moving on to passive stiffness with cold application, there was 1 study which found a cold-induced increase in terminal stiffness during anterior to posterior tibial displacement at the knee joint. Another study also found that both elastic and viscous tissue stiffness around the ankle increased from baseline levels. A lot of the findings from me during this section were very small, if significant, but a lot of stuff really just didn't stand out in terms of effects of cold for a positive increase in range. Moving on to the effects of heat, Jared, you want to just kick off with that one?
Yeah, I found the hip flexion range of motion to be by far the most robust out of the findings for effects of heat. Here they had 4 studies that found the hamstring heating increased knee extension or standard leg raise range of motion. The largest increase from this baseline was a mean difference of 8.8 degrees, and this study also reported significant increases in range of motion compared with an untreated control. So I think out of all the heat and range of motion research, I think that has the greatest clarity. As it seems like you'll probably get about 9 degrees increase in that range of motion. And I'd like to move just straight into kind of the real meat of the paper, where it talks about the effect of heat or cold used in combination with stretching. And here they have a large number of studies compared to the effects of stretching only to stretching combined with either cold or heat interventions, with all studies reporting range of motion. So this is really the bulk of the systematic review here. And so first, just looking at cold and stretching versus stretching only in a single intervention, there were 5 studies here, and they found effects in favor of cold and stretching over stretching alone, which, as Chris mentioned before, I think is a little bit odd and unexpected and interesting. Although this was based on a single intervention One study here, Brodowicz and colleagues recorded the largest increase in range of motion of a mean difference of 23 degrees, with others finding mean differences of about 6 degrees and 4 degrees. Effect sizes in the remaining studies were small and statistically insignificant. Regarding cold and stretching versus stretching only in multiple interventions, rather than just a single intervention, 3 studies used multiple interventions over periods of 5 days or 4 weeks. There were no significant differences in range of motion at the end of each study. The largest between-group differences were in favor of stretching only. And so in a single intervention, maybe it's beneficial to have cold and stretching, but if we apply that as a training period over 5 days or 4 weeks, then it looks like it would be better to just have stretching than cold alone. So it could be maybe just sort of a sensation, sort of distracting stimulus that the cold gives rather than something that actually improves your training. Now, looking into the much more interesting aspect, in my opinion, the heat and stretching versus stretching only in a single intervention, 11 out of 12 studies reported larger increases in range of motion after a single intervention of heating and stretching compared with stretching alone. I think that's pretty definitive. Only 2 effects in favor of heat and stretching reached statistical significance, however. Moving into the final bit here about heat and stretching versus stretching only in multiple interventions. So this is actually doing an actual training program of heating and stretching. Like if you were to do heated yoga consistently over a period of up to 5 weeks, here they had 10 studies examining the effects of the multiple interventions, and 4 of these studies out of those 10 found little differences in range of motion between groups at the end of the intervention package. The remaining 6 studies found effects in favor of stretching with heat, with 4 studies reaching statistical significance. The largest effect in favor of heating and stretching was reported by Draper and colleagues, based on a mean difference of 11 degrees. So we see here that over a training period of about 5 weeks, you might be able to get an 11 degree increase in your range of motion using heat with stretching compared to stretching alone.
Really, for me, this just makes sense. Stretching the heat.
Yeah, hot yoga is good for you, probably.
And on the flip side, I have never found stretching cold to be enjoyable. So
no, it's absolutely horrible. Super
horrible. Yeah, that's a great way to describe that. Now, respect to the heating dose, because that potentially has more of an applied reasoning for this type of podcast. There was a few studies which compared different modes of thermal intervention. 2 studies found significantly greater increases in range of movement based upon a pulsed dry heating device and shortwave diathermy compared to a moist heat pack. Interestingly, one study found that heating for 15 minutes resulted in larger increases in ankle range of movement than did a 30-minute treatment duration. I would assume that's from a physio type situation. Another study compared combinations of hot pack and stretching with ultrasound and stretching, and despite recording active and passive ankle range of movement after 2, 4, and 6 weeks of treatment, there were no significant differences between both of these type of groups.
Regarding the duration of effects, there were a small number of studies that reported outcomes beyond the immediate stages of treatment. Despite reporting an immediate effect on knee stiffness, 2 studies found no significant differences at 15 and 20 minutes after icing. Reed and colleagues and Henriksen and colleagues found that heating and stretching combined and stretching alone both significantly increase knee joint range of motion for up to 30 minutes after treatment, but there were no between-group differences, unlike the possibly between-group differences between my audio and Chris's audio coming up, because it sounds like the rain has really started at Chris's house.
Actually, the sun's just come out, which is really strange.
Has it really?
Yeah.
Oh, but is it raining though? Because I swear I can hear tons of rain.
No, it sounds like I can hear tons of rain at your end. So just so your listeners are trying to figure out what's going on, we're recording.
Oh, it isn't mine. 100%.
We're recording these during the middle of our summer storms here in Brisbane, Queensland, Australia. So we'll tend to have these huge storms. We'll come over, and then just as soon as they come, they'll disappear, and the sun will come, and you can get on with your day.
Which is a good thing overall. I mean, we do sort of switch right over from emergency alerts for bushfires to emergency reports for flooding.
Yeah.
That's, yeah.
So back to the podcast, we've just gone through the results there. Really, just in summary for me, it just shows that heating is more effective for range of movement than is cold. And once again, there are some studies which say that, but that cold could be effective, but how? But I definitely know as a coach, I can definitely attest to when you apply some heat to athletes, they definitely do respond that to stretching and getting that range of movement, and just from that pain sensation to feel like they want to stretch. With respect to the summary of the findings, as you see there was they open up with this really nice disclaimer. There was a consistently high risk of bias across included studies, and they were unable to find meaningful subgroup studies into high and low quality. And that's one good thing about a lot of these that Jared picks out there, that they really try and find high quality studies, but they really struggled here. They thought here that the poor quality of the evidence and the small number of participants with many included studies meant that the findings should be interpreted with some degree of caution. The majority of studies assessed the range of movement using gynometers and inclinometers, and both these devices have been shown to have high intra and inter-rater reliability. And there was conflicting data on the effects of cold and range of movement, and there was clearer evidence that the heat increases range of movement. And I think that's a big thing, with the number of the studies showing statistically and clinically significant effects. Heat also seems to be an effective adjunct to stretching, as both Jared and I have said multiple times throughout this review.
Right, and going a little more in depth into the discussion on therapeutic heating, the authors write that increasing soft tissue temperature prior to exercise is a popular practice, and heat is thought to alter the viscoelastic properties of collagenous tissues in preparation for physical activity. I think that makes sense to pretty much any of us that have done that. As you heat your tissue, it feels like it becomes a bit softer and more malleable, and it just feels easier to move around. And the cumulative increases that we experience in our range of motion when they're reported with heat and stretching can be repeated over periods of days or even months. And there's lots of different mechanisms that might underpin these heat-induced increases in the range of motion. There's been some in vitro research into the effects of temperature on tissue mechanics, and this shows explicit patterns with different human tendon tissues, all of which reduce the stiffness and have greater viscous mechanical behavior at higher temperatures. So it seems to be consistent that that's how that tissue works, which I think we can relate to lots of other materials. As you heat up plastic or metal, it also becomes more malleable. And so it makes sense that our human tissue as well would become more malleable as it heats up. Although it is possible that this could really just be an increase in our stretch tolerance, which is based on sensory stimulation and analgesia. And so it might just be sort of distracting us from the pain sensation when we're stretching. And because we're distracted, we're able to stretch a little bit more. I think that might be a little bit of the basis for why cold might also sometimes, at least in the short term, be effective for increasing range of motion. It's not that it's affecting the actual tissue properties, but that just the sensation is distracting, and so people aren't noticing the pain as much, and it can have a bit of that analgesic pain relieving effect.
Yeah, good point about that. Yeah, I really like that extrapolation there, Jared.
Thanks.
Well, that's a really good summary there, Jared, and I think that's where we're going to leave the podcast there today. So thank you very much, Jared.
Oh, thank you, Chris. And thank you, Elite Form, and thank you, listeners.
And we'll see you in 2 weeks' time for our next podcast. We're going to move on to a new theme here. At the moment, we're looking at isometric training because that seems to have pretty good following at the moment. So if there's anything else that you're really interested in and you want us to form a little mini-series, make sure you connect with us at Snippit Sports Science if you're actually still listening to us at the end of this podcast, because I know if you're like me, you tend to skip to the next one already. So if you have listened all the way through, thank you very much for putting up with us, and we look forward to talking to you in a fortnight time. Thanks for listening.
Thank you.